when I awoke to a fire alarm and could see flames shooting out from the side of the building a few units away from me.
We had a massive amount of snow come down and then a melt followed by an ice storm. And so it was too treacherous to be able to attend my dialysis appointment.
We were hit with a massive electrical outage. We were a home dialysis patient at the time, and we had no power in the house and we did not have a generator.
I left the condo with my purse and my cell phone and only later thought about my transplant meds that I had left behind. At that time, I thought my unit had gone up in flames. I could just, from seeing all the fire in the building. So I assumed that the meds were lost with everything else. So my big concern was for my transplanted kidney was to get a new supply of pills.
It was the first time that I had had an interruption in my dialysis, and it caused me a lot of worry about as to what the outcome of that would be.
You know, I can always just come off and dialyze again the next day if it was just a standard electrical outage, but this was a multi-day event.
It has been quite a challenge getting used to the fact that my activity can be so limited now by severe weather events.
And a month after being evacuated, I had a kidney transplant, and that all went well. It's just it was a bit of big change having to recover, not at home at my evacuation place.
You don't look too far into the future. You're like, okay, I need to get to this treatment, and that will clear me for 3 to 4 days. The hospital was able to communicate with me through our landline. They just snapped into emergency management mode.
My kidney care team responded quite well. They checked in with me to see what supplies I had, in what situation I would need to call for an ambulance or to go to the hospital.
You have to be ready to be flexible. I think part of what's allowed me to survive as long as I have on dialysis is that I generally live a fairly regimented life in terms of diet and fluid intake.
One of the things that I think could have worked better is to have some of that information ahead of time. Like now I know, be prepared with these food items, with these different things to have on hand. Until I was in an emergency, I wasn't really sure what type of things that I would need to have. I have 2 sons who are very invested in my care, and they are appointed to advocate for me and stay very, very up to date with what my medications are and where they can find a current list.
The patients and their caregivers make sure that they have a little emergency kit to keep by the door, maybe with the medications, other information, phone numbers that they might need in case of an evacuation.
It's very important to have some practice or to think through what might come up with these different emergencies and what the patients might need, and to provide that information ahead of time so that patients aren't left wondering, and then that increases anxiety or depression.
Like, it would be good to sort of know what the plan is before you need to implement it. So that would be a combination of the healthcare team and the patient working collaboratively. Being flexible, asking questions in a constructive manner, and just recognize that everyone's working in the emergency for the betterment or the continuation of care for the patient.